Hey everyone, and welcome back to the channel. Today we're diving into a topic that might sound a little surprising, but it's incredibly important for your overall health. We're going to talk about your mouth, specifically your teeth and gums, and how their health is directly connected to one of the most vital organs in your body, your heart. It sounds like two completely different parts of the body, right? Well, research is showing us a powerful and frankly quite scary link between tooth infections and heart disease. So if you've ever thought, it's just a small toothache, it'll go away, you'll want to stick around. We're about to uncover why that little problem could be a much bigger deal than you think. So, let's start with the basics. What exactly is a tooth infection? You might know it as a dental abscess. It's essentially a pocket of pus that's caused by a bacterial infection. This can happen in different parts of the tooth for different reasons. It could be at the very tip of the root, which is called a periapical abscess, or it could be in the gums right next to a tooth root, known as a periodontal abscess. No matter where it is, the cause is almost always the same: bacteria. These nasty little germs can get into your tooth through a cavity, a chip, or a crack, and once they're inside the soft inner part of the tooth, called the pulp, they start to multiply. Your body's immune system rushes to fight them off, and the battleground becomes that pus-filled abscess. The classic symptoms are a severe, persistent, throbbing toothache, sensitivity to hot and cold, pain when you chew, fever, and maybe even some swelling in your face or cheek. It's not a pleasant experience, to say the least. Now, here's where things get serious and start connecting to the rest of your body. A tooth infection isn't like a splinter in your finger that you can just pull out. It's a localized war zone of bacteria. And if it's left untreated, those bacteria don't just stay put. Think of your mouth as a gateway to the rest of your body. It's packed with blood vessels, especially in the gums and the roots of your teeth. When you have an active infection, the bacteria can break through the barriers of the abscess and enter your bloodstream. This is a condition called bacteremia. Once these oral bacteria are circulating in your blood, they can travel anywhere in your body, and that includes your heart. They're like unwanted tourists traveling through your body's highway system, and they can cause a lot of trouble at their destinations. So, what happens when these oral bacteria reach the heart? This is where the connection to heart disease becomes crystal clear. One of the biggest risks is a condition called infective endocarditis. This is a serious infection of the inner lining of your heart chambers and valves, called the endocardium. The bacteria traveling from your mouth can attach to damaged areas of your heart or to your heart valves, where they can grow and form clumps of bacteria and cell fragments. These clumps, known as vegetations, can cause serious damage. They can prevent your heart valves from working properly, leading to heart failure. Even worse, pieces of these vegetations can break off, travel through the bloodstream, and block blood flow to other organs, like your brain, which could cause a stroke, or to your lungs, causing a pulmonary embolism. While infective endocarditis is relatively rare, people with pre-existing heart conditions are at a much higher risk, and a simple dental infection can be the trigger. But the danger doesn't stop with direct infection. There's another more common and subtle way your oral health impacts your heart. It all comes down to inflammation. A chronic tooth infection or even severe gum disease known as periodontitis means your body is in a constant state of inflammation. Your immune system is always on, trying to fight off the infection in your mouth. This chronic inflammation releases certain substances, like C-reactive protein, into your bloodstream. High levels of these inflammatory markers are a known risk factor for cardiovascular disease. The inflammation can damage the lining of your blood vessels, a condition called atherosclerosis, which is the hardening and narrowing of the arteries. This makes it easier for fatty plaques to build up. These plaques can restrict blood flow to the heart, causing chest pain or angina. If a plaque ruptures, a blood clot can form and completely block the artery, leading to a heart attack. So, the inflammation that started in your mouth can create a system-wide problem that directly contributes to the development of heart disease. Let's look at the science for a moment. Numerous studies over the years have supported this link. For example, research published in journals like the Journal of the American Heart Association and the European Heart Journal has consistently found that people with periodontitis have a 25 to 50% higher risk of developing cardiovascular disease. Researchers have even found the specific types of bacteria that cause gum disease inside the atherosclerotic plaques in the arteries of people with heart disease. That's like finding the criminal's fingerprints at the scene of the crime. This isn't just a theory anymore, it's a well-documented scientific connection. The oral bacteria themselves and the inflammation they cause are both major players in the progression of heart disease. It's a double threat. Your body is trying to fight an infection, and that fight itself is inadvertently damaging your cardiovascular system. So, knowing all this, What can you do to protect yourself? The good news is prevention is straightforward, and it's probably things you've been hearing your whole life. It all starts with excellent oral hygiene. This is your first and best line of defense. First, brush your teeth at least twice a day for 2 minutes each time. Use a fluoride toothpaste and a soft bristled brush. Don't just scrub back and forth, use gentle circular motions to clean every surface of every tooth. Second, and this is the one many people skip, you have to floss daily. Flossing removes plaque and food particles from between your teeth and under the gum line, places your toothbrush just can't reach. This is critical for preventing gum disease. Third, consider using an antiseptic mouthwash to help reduce the bacteria in your mouth. But home care is only part of the equation. The other crucial piece is regular dental checkups and cleanings. You should be seeing your dentist at least once a year, or ideally every 6 months. During these visits, a dental hygienist can remove hardened plaque, cold tartar, that you can't remove at home. Your dentist can also spot problems like cavities or early signs of gum disease long before they become serious infections. They can take x-rays to see what's happening below the surface, near the roots of your teeth. Catching a problem early is the key. A small cavity can be filled easily, but an untreated cavity can lead to an abscess, which can lead to bacteremia, which can lead to… Well, you know the rest of the story now. Don't wait for pain. Pain is usually a sign that the problem is already advanced. Be proactive, not reactive. It's also really important to be aware of the warning signs of a potential problem. For gum disease, look for gums that are red, swollen, tender, or that bleed when you brush. Receding gums or persistent bad breath are also red flags. For a tooth infection, as we mentioned earlier, a severe toothache is the most common symptom. But also pay attention to any swelling in your gums or face, a bad taste in your mouth, or a fever. If you experience any of these symptoms, don't ignore them. Don't just pop a painkiller and hope it goes away. Make an appointment with your dentist immediately. An untreated dental abscess can become a life-threatening emergency if the infection spreads to your jaw, your neck, or even your brain. And as we've discussed, it poses a significant long-term threat to your heart. So, let's wrap this all up. The health of your mouth is not separate from the health of your body. It's a window into your overall well-being. The bacteria and inflammation from a tooth infection or severe gum disease can and do contribute to serious cardiovascular problems, including heart attacks, strokes, and infective endocarditis. The link is real, and the science backs it up. Your daily oral hygiene routine and your regular dental visits aren't just about having a pretty smile. They are fundamental practices for protecting your heart and your long-term health. Think of your toothbrush and floss as essential tools in your heart health toolkit. It's a simple, powerful way to take control of your health. Thank you so much for watching today. I hope this information has been eye-opening and empowers you to take your oral health more seriously. If you found this video helpful, please give it a thumbs up and share it with someone you care about. It could make a real difference. And don't forget to subscribe to the channel and hit that notification bell so you do not miss our future videos on health and wellness. Take care of yourselves, and we'll see you in the next one.